Good afternoon. Welcome to the County Health Rankings and Roadmaps webinar on partnering with community police. This is the second webinar in our partnership series. And my name is Jan O'Neill, and I'm a community coach with the County Health Roadmaps Project. Also with me today is my colleague, Kirsten Simmering, who will be helping with questions and posting links to relevant tools and websites. You'll find a link for the slides in an email we sent earlier today, and Kirsten will also be posting this link, that same link, in the chat box. We're recording this webinar, and it will be archived at the same link as the handout. We're pleased to be joined by Kirk Smith, President and CEO of the Greater Flint Health Coalition, and Officer Tanya Meeks from the Flint Police Department. They're joining us today to share their story of partnership between the Greater Flint Health Coalition and community policing in Flint, Michigan. The County Health Rankings and Roadmaps program is the result of the contributions of many partners, including the Robert Wood Johnson Foundation, our colleagues here at the University of Wisconsin Population Health Institute, and the various partners who help us compile the rankings data and get the message out about rankings and roadmaps. I want to take a moment to get you oriented to the technology we're using today. The GoToWebinar attendee interface is made up of two parts. On the left, you can see the viewer window, on which you'll see my screen throughout the presentation. And on the right, you can see the control panel, which is where you can interact with us. Because of the number of people we have on today's webinar, we'll be taking questions via the control panel. So feel free to enter your questions in the control panel at any time, and we will answer them toward the end of the webinar, or sometimes during the webinar if we can get to them. And if we don't get to your question during the webinar, we will follow up with an email. So here's a quick outline of what we'll be talking about today. Because we have both people familiar with our site and those that are less familiar, we're going to start with an overview of the County Health Rankings and Roadmaps program and site. If you're already familiar with us, you may want to take advantage of this time as I'm going through that overview to explore some of the links that Kirsten will be posting in the chat box. Then we'll hear from our guests about their partnership in Flint, Michigan. And then we'll open it up to Q&A. And after Q&A, we'll show you where you can find guidance and tools on our website. And specifically, we're going to focus in on what works for health, our database of strategies, to show you where you can find evidence related to community safety. Finally, we're going to close and wrap up with some final thoughts. So at the beginning of this webinar, we showed you some poll questions, and we'd like to do a quick poll right now. We call it a rapid response poll. We do it very quickly to see where you are with regard to partnerships in your community. So I'm going to launch this poll right now and ask you to take a look and answer that as best as you can. We'll give you about a minute to complete. Thank you very much. Very quick response. We've got about half of you have voted. Give you another couple moments here. By the way, these terms are from Tom Wolfe, who's written a wonderful book called The Power of Collaborative Solutions. And we don't have that in the link here, so we should probably put that in the link. But he's got a great description of the various stages that coalitions and partnerships go through in communities. That's where these terms come from. Okay, I'm going to close the poll, and I'm going to count down 3, 2, 1. So if you haven't voted yet, 3, 2, 1. We've got about 80% of you. I'm closing it. And now let's share the poll. So very interesting. Thank you all very much. And it looks like we've got the majority of folks are in that networking and sharing information stage, which is obviously very fundamental to putting a partnership together. And maybe that's something, Kirk, you could speak to, just touch on in your in your part, because you're very much well along in your partnership, and that's something maybe you sort of set as a foundation there. You have to know about each other first. Well, thank you all very much for participating in our poll. I'm going to move on now to the essential question for today's webinar, which is how can we partner with community-based organizations to improve health for all? So I'm going to turn now to an overview of County Health Rankings and Roadmaps, the program. Again, if you've been through this before, Kirsten's posting some links that might be of interest to you. Specifically, Kirk is going to be talking about collective impact, actually, in his section with Officer Meeks, and that's a concept that we covered in the first kickoff to the partnership webinar series, because we had folks from the key work group, Community Toolbox, talk about collective impact. So if you've been with us before, you'll recognize that term, and I recommend that you go and explore that link. So let's just start here. This is the logic model that shows why we release rankings every year. Our ultimate goal is to create a healthier nation, county by county. And the rankings release attracts media attention, which gives community leaders an opportunity to use that as leverage to engage their communities in action that will improve health. And the bottom rank about why do we rank, it's really, at the end of the day, it's all about a call to action. So you'll see this whole horizontal part, the whole top part of the logic model, underpins the rankings part of County Health Rankings and Roadmaps. The County Health Rankings ranks the health of nearly every county in every state once a year. We've been doing it now for 4 years nationally, and longer than that in Wisconsin. And for each county in the state, you'll find 2 rankings, one on health outcomes and one on health factors. Why 2 rankings? Because there's 2 sets of messages that they convey. One set addresses how healthy a county currently is, today's health. And the other addresses how healthy a county might be in the future based on the many factors that influence health. And this is the model underpinning all of the county health rankings. Starting from the bottom, we believe that effective local, state, and federal policies and programs can improve a wide variety of factors that in turn shape the health of communities. And these many factors shape health outcomes. So we specifically look at health behaviors, clinical care, social and economic factors, and the physical environment.
And just hold on a second. I think that the slides are not advancing as you're talking. I think
they are showing over here. Okay.
Quick poll. Thank you, everyone, for alerting us to this, and we'll try to catch up.
That's interesting. All right. Maybe the poll was still up. Can people see it now? I'm going to keep going. Okay. We measure 2 types. Thanks for letting us know, folks. We measure 2 types of health outcomes to show how healthy a county is, how long people live, that's mortality, and how healthy they feel, which is morbidity. So here's an example. A clean indoor air policy is a policy that can influence health factors like tobacco use, which in turn influences health outcomes. County Health Roadmaps is focused on the orange policies and programs component of this model. We often point...
It's still showing you this, just the poll, sorry.
Okay. Okay, so I'm going to keep going, and we're going to see if we can get some help on this, and this has not happened before, so my apologies. So this model, we point to this image as one of our most important because it outlines what we use to determine county health rankings, all the factors, and what influences health in a community. And it also makes clear why improving health isn't just up to public health or health care. We need every sector involved, and if we're really going to make a difference in how long people live and their quality of life in their community. So I'm showing the next slide. Let's see if people can see this. Are they able? Are they seeing it yet?
It's still showing the poll. Still the poll. I want to just make sure that your computer is the one in charge.
Okay. Well, what we're going to do is, this is kind of bringing us to a full stop here. So,
There we go.
oh,
There we go.
all right.
Thank you, everyone, for your patience.
Sorry, folks, that hasn't happened before. Okay, so I'm not going to go over this whole slide again, but this was the very complex, most important image that we were talking about that underpins the rankings. And I was pointing to the orange part of it. The policies and programs is where the roadmap comes in. Okay, so now if we went to the home page for County Health Rankings, you'll see a map where you can click on your state and from there to your county to find out how you ranked this year. And you can also look at the past 3 years to see how you've ranked. But again, it's all about a call to action. It's not just about the rankings. Now I'm going to go back to the logic model. The roadmaps project is the right-hand vertical section of this model. So now that you have your community's attention, you want to find the best possible strategies, ones that have some evidence of effectiveness, to focus on your community's health priorities. And ultimately, by taking collective action using effective policies and programs, over time, people in your community will live longer, higher quality lives. Well, this is a model that explains the why and the what behind county health rankings and roadmaps, but how do we actually do that? How do we take action? Well, we've got a very generic take action cycle, which will probably look very familiar to those of you that are using MAP or other strategies. This is the how within county health roadmaps. It's simple, it's straightforward, and it allows communities to follow through these steps to improve health. At its core are people working together because we know solving problems like poor high school graduation rates, excessive drinking, inadequate health care require the wisdom and resources of people from all walks of life. So basically what this cycle does is helps us gather information, we can set priorities, we can find the most effective approaches to address our priorities, and then we really want to spend most of our time on the left-hand side of the cycle. We want to just take action, adopt, and implement, and of course evaluate throughout the cycle to help us improve our strategies and ensure that the time that we're investing in the money are being effective. And you'll also see that communicate sits in the center of the cycle as well. That's because communication with stakeholders is really essential throughout the take action cycle. So, now, without further ado, I'd like to introduce our guest presenters, Officer Tanya Meeks, who is a 14-year veteran with the Flint Police Department. Officer Meeks wears many hats, including Blue Badge Volunteer Corps Coordinator, and most of her career has been spent as a community policing officer working with various community groups and schools, speaking to youth about violence and drugs and peer pressure. And she's the coordinator for Crime Stoppers of Flint and currently serves as the city's Chief Service Officer as part of the Cities of Service Impact Volunteering Fund grant. So welcome, Officer Meeks. And I'd also like to introduce Kirk Smith, President and CEO of the Greater Flint Health Coalition. Kirk began with the Health Coalition in 2005, and he's served in his current CEO role since 2010. He holds a Master's of Health Service Administration degree with a focus on health management and policy from the University of Michigan School of Public Health. So welcome, both of you.
Thank you. Thank you. Good afternoon.
Thank you. Can you speak up just a little bit, Kirk?
Yeah. Good afternoon.
Thank you. Can you first locate us, Kirk? Where is Flint relative to the state of Michigan, and how does it rank?
Flint is located in Genesee County, Michigan, and the county population is approximately 425,000. The city of Flint is sort of the urban core of the county and makes up just over 100,000 of that population. You can see Genesee County circled on the map. Our rankings in the state of Michigan in both health outcomes and health factors are near the bottom. Per the 2013 rankings, Genesee County ranks 80 of 82 in health outcomes and 75 of 82 in health factors. Our area of strength in the rankings is clinical care. We rank 18 of 82 in Michigan in that factor. And we have challenges that we are working to overcome in the areas of health behaviors, where we rank 77th, social and economic factors, where we rank 73rd, and the physical environment, where we rank 76th out of 82.
Thank you, Kirk. And can you tell us about the Greater Flint Health Coalition, how long it's been in existence, who's at the table, and what your goals are?
Yes. The Greater Flint Health Coalition has a lengthy history. We've been serving to bring the community together to address a variety of health status improvement issues since 1996, when the coalition was established as a 501c3 nonprofit. The image on the right that just popped up is a good one. I like to use it a lot in describing what the Health Coalition does and who we are and who comes together at our table, because it's a unique, neutral entity that is really focused on bringing together leadership, organizations, and different community groups together that typically don't always work together to address health in most communities. So these different sectors of the Health Coalition are what make progress in this collaborative partnership possible by bringing together our community's hospitals, physicians, business, health insurers, public health professionals, policymakers, government leaders, educators, organized labor with the roots of this community, and residents, really all those who are concerned about the well-being of our community and its residents. While those are the sectors at the table, the Greater Flint Health Coalition has not only structured itself in a way to bring these different sectors of the community together, if you can move to the next slide, but to bring the community's leadership together to make change and progress possible. I understand this slide has a lot to read here, and I think it's really important, though, to understand, really, in our opinion, what coalitions should aspire to create as they engage in collaboration in their community. We've been able to bring this group together for over 15 years, so we know it works. This is a good description of a health coalition that we have from board level. So it consists of hospital CEOs, as well as leadership from the community's other major healthcare provider organizations, like our federally qualified health centers and our community mental health authority. Physicians are critically important to what we do, and they're engaged in an organized way through our local medical society. Leadership from our region's major market health insurers are represented on this board, as are community leaders like City of Flint Mayor Dane Walling, and designees from the County Board of Commissioners. The County Health Department's health officer, the County Director of the Department of Human Services are at the table, as are local college presidents, major business leaders, and representatives from community and faith-based organizations. And while this is one strong and it's a dynamic leadership group, our structure as a coalition goes much deeper. And we actually convene what I like to refer to as approximately 20 coalitions within our coalition. These are the same sort of cross-sector composition, committees, task forces, and programs with dedicated subject matter experts and community partners that total about over 300 people from over 100 different community organizations and bodies. As far as the goals of the Health Coalition, coalition-wide, our mission is very simple, and it's twofold: to improve the health status of our county's residents and improve the quality and cost effectiveness of the healthcare system in our community. We simply want the people to live in this community, to practice healthy lifestyles, and have access to the things we all need to make that possible in terms of where we live, learn, work, and play. Our efforts as a broad-based coalition have specific goals in our major focus areas of health improvement, access, quality, cost, as well as sector workforce development. And in everything we do, because it's a need in our community, we work hard to incorporate efforts to address racial disparities and improve health equity in all of our activities. As we work in these focus areas, we as a coalition, we've established and agreed upon goals and strategies for each and every focus areas, as well as each individual initiative we undertake. We have metrics for everything that we do, both quantitative and qualitative, because, and I can't emphasize this enough, to measure our progress in each area is so important from a planning and progress perspective. And it really helps to validate and reestablish priorities each and every year, because what's working or important today is definitely not going to be the front and center issue 5 years from now. The image on the screen is an excerpt from the Health Coalition's 2020 Strategic Business Plan, which highlights some of those high-level goals that we charted through 2020. In addition to this strategic plan of the Health Coalition, which really covers all the work that we do, our community has used the county health rankings to build a greater emphasis on a number of areas of opportunity for our community to collaborate on to eventually reach our overall goals as is shown in that plan. Specifically in reaction to the first county health ranking study of 2010, our county ranked 82 out of 82 in the area of health behaviors. That was a catalyst. It helped us bring together, even to a greater extent, cross-sector leadership that developed a specific plan to target this area using a multi-part approach as emphasized by each area in green highlighted on the screen. So smoking, physical environment, neighborhood safety, public transportation, as well as physical activity, breastfeeding, and nutrition and diet. The County Health Rankings Action Plan that we established is broad, but it has specific goals for our community for the next 10 years in this area of focus. And the health rankings really help make that happen here.
So it's a great example, Kirk, of that logic model that I went through. It really gave you the leverage to call people to action, it sounds like. Can you tell us a little bit about the community-based initiatives relative to public safety and how they complement or differ from the more traditional models of policing? For example, we understand the city emphasizes a model known as community policing, and I'm wondering, Officer Meeks, if you could tell us about that.
Sure. Community policing, and it's been in effect for years and years. Flint was one of the pioneers for that. What we did, more or less, community policing is a proactive versus a reactive, and we have put mini stations in certain sectors of the city. Those mini stations are ran by volunteers, and assigned to those mini stations is an officer, and that officer is assigned to that community. They don't necessarily just sit there and wait on calls to come in. They patrol the area, they stop in, they can do their reports and so forth like that on the computers. But they're in the area. They can work with the residents for the crimes or nuisance calls that we may receive that are going on in that area. So where you may have two residents that are squabbling, whether it be your dog is in my yard doing his business or whatever, that officer, before it escalates into a big fight, which may even get even as big as your family coming over, that other family coming over, they can de-escalate that, work out the situation versus calling 911, and you have a patrol officer who may come right now. Tomorrow it starts up again. You get a different patrol officer who does not even know anything about what happened yesterday. But if you can utilize that community policing, which these officers are assigned to this certain area, they're already aware of the problem, and they can continue to work with those residents to get that problem solved. So also, Flint was one of the pioneers, like I said, of community policing, especially the foot patrol. And even in today, we're trying to initiate that foot patrol aspect back into it. However, that is going to take some time. But at one time, the city had a very strong network of community organizations, including over 200 block clubs, which consisted of also crime watches and neighborhood associations. And the many station officers were responsible for serving the police department's liaisons. They were liaisons to those community organizations addressing the crimes and issues of social disorder, which brought to the concerns of citizens. Excuse me. When the police department was restructured in the 80s, there was a focus more so on vehicular patrol. So the activities of the neighborhood group started to kind of diminish. They held on, but they kind of started to slow down. And then when the police resources began to shrink, the many station officers were reassigned to patrol. When I came on 14 years ago, we had 40 community police officers, including a captain, lieutenant, and several sergeants that were assigned. And today, 14 years later, as many of you I'm sure are aware, we've suffered loss of resources and so forth with the automotive industry and so forth like that. So we're down to maybe like 9 officers still servicing the same city, same 9 sectors. So what we've had to do is ask more or less for a little bit more help from our police volunteers, our community. And we've always had police volunteers ever since I've been here, and before my time, they were here. However, in 2010, our mayor more or less revamped it and came up with what is now called Flint Blue Badge Volunteers. It is a very good initiative. It's an umbrella initiative for recruiting and engaging a corps of citizen volunteers to fight crime and reassert control over public space in Flint neighborhoods. And don't think that they get out and they go and patrol and so forth. Not like that. It's not. It's an education tool. It's also a way for residents to give back. Those of them that want to volunteer, research strongly associates volunteering to stronger communities. Their measurable health benefits, individual academic achievement, and community participation. The Blue Badge Volunteer Course is built upon the principles of community policing. Community policing means community members are the ears and the eyes. They don't go out in cars, they don't patrol and so forth like that. They're the ears and the eyes for the police, addressing both crime and quality of life issues. The Blue Badge Patrol is the umbrella for all City of Flint crime-fighting initiatives, and so whatever it may be, it could be in our mini stations, in our police department, city cleanups, whatever volunteer effort is put forward, it falls under that Blue Badge group. So we do all of our block clubs there, all of our crime watch, the mini stations, the volunteers, and so forth like that. I'll describe a number of these efforts in the next couple of slides, such as the Blue Badge Volunteer Corps assists the city with supporting a number of Blue Badge service centers. Right now we have 6, and they're located throughout the different parts of the city. A few months ago we had 10. However, we downsized that. We started with 5, and we also added 1 more with one of our local colleges. These include the north side, the south side, and the other 4. And we have one that is located, like I said, on the campus of Kettering University, and another which is located in proximity to our hospital, which is Hurley Medical Center. The Blue Badge volunteers support community policing by assisting at these service centers, and they volunteer whether it be 2 hours, 4 hours. Some of them come in and they do 8 hours, at which time the residents can help the residents get assistance by using our CopLogic, our online police reporting services. Just recently, we started a recycle program here in the city of Flint. And what they did was we took the recycle bins, the sign-up forms, and any information pamphlets, and we put them in certain areas of the mini stations. So, in certain mini stations throughout the city. So instead of residents having to drive all over the city, they just stayed right there in their community, and they could go to their community service center and pick up their recycle bins. Also, we just did a city-wide cleanup, and there were resources available to assist the groups with those cleanups, such as garbage bags and compost bags and gloves and so forth like that. So being that this was something that the city was offering to the residents, instead of everybody having to come downtown and park and do the meters and the downtown thing, which intimidates a lot of people, they were able to stay right there in their communities and go forward with those efforts. In addition, the city also works with residents to train police volunteers. The volunteers complete a series of training modules, and then they work with the police and staff to assist in large community groups. So we have them do an application, and they do a background check and so forth like that, and then they will go through a mini police academy with the understanding that they will not be carrying guns, they will not be patrolling, but more so that it's a help to the community. But there are certain things that I learned in the police academy that also the community needs to learn, or the volunteers need to learn, because they are coming into more or less a police environment, and they're going to have to deal with the public on a lot of different issues. So we did de-escalation, health and safety, such as the blood-borne pathogens and stuff like that, defensive tactics. But one of the ones that I really like, because we're in a day and age where we're doing, everybody's getting their CCWs or CPLs, and I thought it was best because I'll always go to meetings and they'll say, hey, well, if somebody comes in your house, can you shoot, or this and the other? And we did a simulator, a shoot-don't-shoot simulator, and they really, really enjoyed that. So those are some of the trainings that we do for our volunteers. Flint Police Blue Badge also does a tremendous work in engaging, organizing, training, and supporting the neighborhood-based volunteers. Safety can be improved because we do a lot of crime prevention. We have a neighborhood group association that has evolved from this. I am the only crime prevention and many other hats that I wear officer in the department, and I was finding that people were calling and they were saying, hey, Officer Meeks, can you come to my Black Club meeting? Can you come and talk to my group about this, that, and the other? Well, Officer Meeks also has a life, and she likes to go home when her shift is over, and it's hard for me to say no because I know a lot of these groups and organizations and neighborhoods are struggling. So what we did, I came up with this thing. I'm like, if I can get all of the presidents and all of the leaders of these groups to come to one location, we can share information, problem solve, and then they can take that information back out into their groups. And I won't have to make so many group meetings or miss them just because my schedule is so hectic. So the first Saturday of every month at 9 o'clock, we started what is now called Flint Neighborhoods United. It is right now probably about 40 members strong. And like I say, there are different Black clubs and organizational groups throughout the city. And we had a list in the very beginning of, from the ceiling to the floor, the paper stretched of all the community ills and some of the complaints that the groups were having, which a lot of them were similar. We narrowed that down to where we are working on 3 at the moment. And those 3 is communication, because communication throughout our city, the north side didn't know what the east side was doing, and the west side and so forth like that. And you have Black clubs in this city that some of them have grants and are doing wonderful things, and other ones didn't seem to be able to get up and get started. So now we're all at the table together, and this group or this team Black club leader can help the next person, and we can share ideas and so forth like that. So we meet for 2 hours the first Saturday of the month. Right now, we have efforts that are going forth for revitalization, cleanups and so forth like that. And with this communication group, we've been able to make sure that that word gets spread throughout the city. One of the other areas that we chose to work on was the blight, and we do have a committee that is working on that, working with the city and all the other organizations that can help, whether it be with there's demolition and so forth going on like that, whether homes need to be boarded, who do we contact, and so forth like that. And then our third area was party stores. We have a tremendous supply of party stores here in the city. And the residents felt that even though they are there and they may not be going anywhere anytime soon, we needed to ask them to step up their efforts to get rid of the blight, the garbage that surrounds their stores, from their customers dropping paper and so forth, and some of the other ills that go along with a party store. You have the loitering and the loud music and, you know, some of the things that they may sell inside their stores. So we broke down into subgroups, and that's how we're working right now. We actually just had a situation here in the city where at one of our local nightclubs, there's a very, very high rate of violence that was surrounding that club, and the state went in and they did actually they suspended the license. Well, of course, then there comes a hearing, and for the club to get the license back, and we as Flint Neighborhoods United sent a letter asking them, hey, before you give this club their license back, let us as a community group come in and voice our side as to why, and our concerns as to how this is not a benefit to our neighbors and to our community. So it's actually a work in progress, and we're kind of forging our way through, but so far it's been really, really good. We've organized and participated in the Blight Elimination Services team, and and then we also have like faith-based groups and service clubs and everybody else that's kind of lending in. The image at your right gives an idea of the network of block clubs doing this important work, and we also do our best to assist them in their blocks while also bringing them together to collaborate with one another. This is also supported by our SIPHED training or crime prevention through environmental design. And in these trainings, we work with residents to provide insight on strategies to prevent crime prevention through positive changes to the built environment, the surveillance efforts, and for maintenance.
Thank you so much, Officer Meeks. I would like to zero in on the violent crime rate. That's one of the measures in county health rankings. And given the community policing and neighborhood-based initiatives that you have now underway, there's so many of them, how have the Greater Flint Health Coalition and City of Flint worked together to both bring more awareness to these issues and intervene further at the community level to have more impact? How has that worked?
Okay. Well, the stats on the side speak to some of the challenges we are facing in the community from a crime perspective. The city has made a number of positives over the recent years that have begun to develop the basic infrastructure and network of collaboration to truly improve moving forward. Community policing, of course, by definition means problem-solving partnerships, and we're doing just that. For instance, the police department, working in partnership with the state and the county, have been able to open the city lockup. It has been closed for a multitude of years, and now it's back open. There was a huge step in a positive direction when that happened. The data you see stems from decades of powerlessness of our police officers to enforce the law by arresting people and lodging them in jail for the violations. When the lockup was closed for years, there was simply no capacity or ability to lodge people in jail once arrested on warrant. And those, of course, were like your misdemeanor warrants, which was a lot of the nuisance and so forth like that. We did have our county's facility, but they would only take certain warrants and so forth like that. The good news is now with the reopening of the city lockup, thanks to city partnerships with the state and county officials, the Flint Police Department and the Michigan State Police were able to make over 1,000 arrests, satisfying over 1,500 warrants in the first 3 months of the facility being available again. In addition, the city has worked with the Michigan State Police to use data to identify crime hotspots in areas, and we've seen slight decreases in the number of specific crimes as a result of that. So over time, these efforts, we believe, will have a larger impact with the infrastructure getting back in place. In addition to this, last year we began a new City of Flint Blue Badge, as I said, and the Greater Flint Health Coalition partnership to address health and safety in our community, and the creation of a new health and safety mini grant program. And I'm going to let Kirk talk to you a little bit more about that one.
Thank you, Officer Meeks. The 2012 Health and Safety Mini Grant Program that Officer Meeks mentioned was a new initiative. It's a new partnership that was designed to support the efforts of community policing that Officer Meeks just described, as well as all the block hub engagement that happens through the city's Blue Badge network of volunteers. What we aimed to do with this mini grant program was to help improve safety by basically helping residents' ability to work together on efforts to improve their neighborhood's environments and create safer places for them to be physically and socially active. In doing so, what we did was we provided small grants to neighborhood groups to address issues that they felt would make their neighborhood safer. And we know if a neighborhood or a community is safer, there's opportunities to be healthier. This is not a complicated premise to what we tried to do. I mean, people know what could be improved in their environment to make their life better. They know what needs to be done at their home or on their street or on their block or in their community to make things safer. So we brought them together, we asked them, and offered some small resources to help make those things that they've identified reality around their homes, in their neighborhoods, on their streets. When we launched this initiative, it was a new partnership effort of the Greater Flint Health Coalition, the City of Flint, in partnership with our Commit to Fit initiative, as well as the Blue Badge Community Policing Program. And the response, I think, exceeded our expectations from the beginning. The initial meeting to talk about what the opportunity was brought together over 70 people from the types of groups that Officer Meeks just described: neighborhood groups, block clubs, local associations, different civic and church groups, folks from different nonprofits throughout the community. They were invited to talk about what was impacting their neighborhoods and had to complete a brief application for the project that they'd like to do. What we did was we gave a total of 10 awards. Were given on really a number of different safety-related topics. And again, basic things: improving lighting on a neighborhood block, supporting a crime watch group, making that group more visible and active, aiding in a different community beautification effort, simple things like starting a community garden in a vacant lot, or cleaning up a neighborhood park. What will come up here in this map gives you an overview of the distribution of the 10 projects that we funded. And the area with the dotted line outlines the City of Flint. Given the Greater Flint Health Coalition as a countywide focus of our mission, we also listened to a lot of questions that were received, because all these different community issues and the way that folks want to come together to improve safety and health in their neighborhoods isn't just a city issue, it's a county-wide thing. So what we did was we adjusted a few things to provide a couple of these mini grants outside the city limits, which you see at the very top, in communities that were experiencing some of the same issues that a lot of our neighborhoods in Flint are dealing with. I'm going to have Officer Meeks show some of these before and after pictures and talk about what was done here.
Okay, here are two examples of our neighborhood-based mini-grant project awardees. The OWIR Block Club, they completed a project called Light the Night. And the second one is the East Bishop and East Flint Park Block Club, and they completed a project called Project Light. The before and after change is subtle, but you'll notice that the lighting glows in each of the front yards. Before, these neighborhoods were located in areas of the city near Hamilton Street and DuPont, as well as blocks between North Saginaw Street and Emil King. And these were very, very dark streets, so that's a safety issue for many, and lighting gives you comfort. And that also came from our CPTED training. The block clubs installed the lighting throughout the neighborhood sites with support from neighborhood residents, and the block club members also assisted in the installation. While the residents will support maintenance to continue use of the lights after the grant is completed, and actually they're waiting to see if we're actually going to be able to help them out with future lighting projects. And in our next slide, these are before and after photos of two more of the mini grant efforts. The first one is the College Cultural Neighborhood Association. They established a neighborhood watch mini station project. This was to increase community empowerment and safety by supporting a police mini station and using it as a place for operations for a neighborhood watch. And in turn, in them setting this up, this has grown huge. Their neighborhood watch is a very, very large one in the city. This project is located in the city of Flint's College Cultural area, near Mott Community College, near the Applewood Estates, and Pearson Woodlawn and Burroughs Park. The picture below shows a local neighborhood cleanup effort near the Flint River. So those are just a couple of things that happen with the availability of the grant dollars.
Those are amazing. Thank you so much for having pictures, because they really are worth 1,000 words. Thank you so much. It really gives us a great visualization of the impact of these small amounts of dollars going to the neighborhood. Kirk, what's next for all of you?
What's next is really a continuation of efforts like these. We talked about the plan, and working in areas like this at the community level, whether it's policing or these other areas that we have established goals for in our strategic plan and our county health rankings action plan. The health rankings state the way it really is. I mean, improving health outcomes is not a single source issue. We have a very broad yet targeted approach with our plan, so there's not one answer. For instance, we'll continue to address physical activity, nutrition, tobacco use, and other health behavior related efforts via our community's Commit to Fit campaign. This is a campaign we started not long after the first rankings came out. It's engaged nearly 50,000 residents. It's being used in some form as a shared common message by over 300 different community organization and partners. A number of different programs and efforts have stemmed from this. These include free weekly physical and activity and nutrition classes that we make available at no cost to residents. A number of workplace and school-focused efforts, including a new middle school program we launched this year targeted at 6th through 8th graders called Project Healthy Schools. We hope to continue to offer the Health and Safety mini-grant program in this year and others. We're actually working through the details of how we might make that work right now. And of course, just supporting all the good work that's being done by all the partner organizations in Flint and Genesee County. Working individually and collectively, there are a tremendous number of good things happening here. And we'd refer you to look at this plan online for some more details.
Yeah, Kirsten has posted that link so folks can go there directly. I'm going to, because we are coming to the top of the hour for the webinar, if you don't mind, Kirk and Officer Meeks, we've had some questions. And because the slides are already PDF'd and they should be on the site and also sent out to folks, I'm thinking that maybe what we could do is let people read your lessons learned, but go straight to the questions right now, if that's okay with you, Kirk and Officer Meeks.
Sounds good.
Okay, great. So, Kirsten, do we have a question that we can start with?
We do. Somebody is interested in history and wondering if the community Flint was ever part of the Weed and Feed program.
Yes, actually we had 3 initiatives of that. We had the east side, we also had the north side and north central, I believe, or downtown. But there were 3, and we were very much involved in that.
Oh, great. And sorry, for those on the line who aren't familiar with Weed and Seed, could you just say a little bit about what Weed and Seed is?
Well, where I came in at it, Weed and Seed actually is just weeding out some of the negative that is in the community and planting the seeds more or less for the betterment of the community. And it involved a lot of different initiatives such as hotspots and targeting as far as law enforcement. I know one of the areas that I was involved in was the youth and the anti-drug campaign and so forth like that, and taking the kids to camp. But it spanned throughout quite a few different areas.
It's really a complement to community policing. I mean, it's about, recognizing the importance of bringing law enforcement together with social services, but also existing programs and resources.
Wonderful. Thank you so much. So there's people are really interested in kind of they're so delighted with what you're doing, but they recognize that sometimes it's hard in their communities to get law enforcement involved. So do you all have recommendations for how to get law enforcement kind of to recognize kind of the broader role that they can play in improving population health or improving community health?
I can start. I mean, I think it really just starts with asking the question. I mean, what we know here, there's a lot of challenges in the community. We don't really get caught up with dealing with dwelling on the fact that our ranking is low. This community has a history of pulling itself up and figuring out what we can do about it. Things like our health and safety mini grant program, it's as simple as, there's all these wonderful things that Officer Meeks is doing with all these different neighborhood groups. And neighborhoods want their communities to be safe, and police want the same thing. We started our health and safety mini program. It was really a conversation that started between myself and the mayor said, this starts with bringing in the police. And the next thing we knew, we're in a room with over 70 people engaging these groups to get started. Police want to help. They will start knowing that when they have groups that want to work with them, they'll find a way to help activate those groups. And Officer Meeks is sitting next to me nodding her head yes.
Yeah, one of the best ways, like Kurt is saying, you just have to go and ask. And 9 times out of 10, you're going to be surprised at your answers. If you don't get to the mayor, get to the chief of police. One of the 2 of them should be able to direct you to the person who you need to be with.
Great, thank you. So there is a lot of interest in funding, how you are funding your work. Can you talk a little bit about that and also offer any recommendations?
Well, the health and safety mini grant program was something that it's something that we didn't have a lot of funding for, and I probably should have covered that in the presentation, but a little bit goes a long way when you have community groups that are wanting to work together and are volunteering and already, interested in improving their own neighborhoods. What we did was the ceiling for each and every one of these health and safety mini grants is actually $1,000. So we had a total of $10,000 available from a grant related to health outcomes that the Health Coalition had secured that we had set aside for this targeted community initiative. And the fact that, $1,000, or even in some of these cases, it was a grant for $400 or $500. What you can do with organizing blight removal, cleanup with volunteers, or even starting like a community garden on a vacant lot, supplies aren't that expensive. It's the people power that makes it work, and you can do a lot more with a little bit.
That's a great answer, Kurt. Thank you so much. So we have a question here that actually a couple that have to do with youth. And there is somebody who is looking at the YES program, YES, and it began in Flint. Can you talk about any partnerships that you might have with YES, or do you know about the YES program? And if so, does it intersect and how with the CP10 efforts and possibly with mini grants? First of all, do you know about the YES program?
Yes, I do know about the YES program. Actually, the YES program is something that engages youth. I'm not an expert, but I do know where it started from. It's a project that came out of the Prevention Research Center of Michigan, who does, the University of Michigan is where that is based in Ann Arbor. But the YES project, I think, has gone through a couple of different cycles here in Flint to work on engaging youth in efforts like this. The Health Coalition and a number of these partners that I described are partners with the Prevention Research Center of Michigan. We've actually have a community board here in Genesee County and Flint that I've served on for probably 5 or 6 years now. And the YES program really works with communities to do, again, a lot of the things that the neighborhood-based initiatives that Officer Meeks described, but doing that with youth and doing that over the summer, and they've had some tremendous impacts. I know if you go and look at the PRC, Prevention Research Center of Michigan, anyone on this webinar can find out more information about YES.
Thanks so much. So one of the things that you touched on a lot in your presentation is data, and some people are interested in knowing about any ways that law enforcement could better share data to improve health without compromising privacy.
Well, we have a couple of different ways. Of course, we have input from our local U of M here. We have, they're on board, and also Michigan State University, and they've been doing some data research, and for that part of it that's is non-identifying, they've made it available to the public. Also, we do our stats from our 911 call center in the CAD. It prints out all the calls that come through, and we go through and do what we call washing those reports, where we take out all identifying information, such as a name of a person, their actual address. We'll use like the 200 block of South Saginaw Street versus the actual numbers. We'll take out all VIN numbers, license plate numbers out of those complaints, and we make that information available to the community through our Flint Blue Badge website, and we'll put that information out there, and those actual stats are then pulled by each individual block club, and they share them in their area so they can see what's going on, what maybe they can do to, correct a situation or help out with a situation or so forth like that. So there's a couple of different ways that we're trying to get the stats, and we could do, we're doing a whole lot of others. I think right now the department is looking at a computer program that will actually do it a whole lot quicker than the way we're doing it now.
That is very helpful. I wish we had another half hour to go with you all for questions and answers, but we're about out of time, and I was going to go over to the What Works website. So I'm just going to take a couple of minutes to do that. What I said to folks on the chat, and you all have graciously agreed to, if there's any burning questions that haven't been answered, and you all have been nice enough to say that you would follow up by email. So we'll let you know if there are any of those. So thank you both again so much. I'm going to just take us over to the roadmap site quickly here and point out that one tool that folks can always go to find what works is the What Works database, which is close to 200 strategies that we've carefully reviewed. And if you click on that, what you'll see is you can go to a tutorial that'll tell you how to get around. you could click on one of the health factors and measures specifically to get to a strategy, or you can go in and look by keyword. And so I'm just pointing out here, if we look for strategies addressing crime, what you'll find is a lot of what Officer Meeks talked about. For example, the Neighborhood Watch comes out as being very strong on and scientifically supported as a strategy. And if you clicked on that, what you would find for any of these strategies, but we'll look at this one in particular, are the expected outcomes, what the evidence is, whether it impacts disparities, where the implementation examples are, and even some resources for implementing. And you'll also get related policies and programs. So that's a pretty rich resource for people. And we also have some archived webinars that talk about how to use What Works database with our lead What Works. Allison Burgum is leading those webinars, and also communities that have used it with their community to select which strategies they think will work best in their community. And speaking of webinars, I just want to mention that this year we have two brand new series starting up. One is breaking down the rankings model, and the other, of course, is this one, the partnership series. We are continuing the Take Action webinar series again this year. And we send out announcements about upcoming webinars in our e-newsletter. So if you haven't subscribed, now's a great time to do that. We started this whole webinar with this question, and we hope that you're leaving with some answers. I feel like I've got answers to this. And I really, again, so appreciate your time on this, Kirk and Officer Meeks, and perhaps you all on the webinar have formed some new questions as a result of today's webinar as well. And if you do, encourage you to get in touch with us. Thanks to the support of the Robert Wood Johnson Foundation, there are 3 of us who are community coaches in the program, and our assistance is no cost to you. So don't hesitate to email or call us wherever you are in your health improvement journey, and we're here to help you. And again, I encourage you to stay connected with us. And finally, I want to thank you again, Kirk and Officer Tanya Meeks from Flint, Michigan. We so appreciate you sharing your knowledge with us today. And thank you all for your patience with the webinar slides. And this hopefully will be recorded and will be on our website later, where you can find it along with the handout. Thank you all, and goodbye.